Good afternoon. I'm Greg Hart, Chair of the Santa Barbara County Board of Supervisors. This press conference is broadcasting on County TV Channel 20 and the county's YouTube page. The meeting's being interpreted in American Sign Language by Kim Rich, and Carlos Saracedo is interpreting the press conference in Spanish. His interpretation will be available on the county's website and YouTube page shortly after we conclude the press conference. Just over a month ago, Dr. Anzorg set an aspirational community-wide goal to work together to move Santa Barbara County from the purple tier to the red tier by the end of September. We've achieved this very important milestone this past Tuesday when Governor Newsom announced the new state report card. COVID-19 cases have dropped dramatically county-wide over the past month to the adjusted case rate of 4.5 as announced on Tuesday with the state's new report card. The top of the case threshold for the orange tier is 3.9 cases, so we're very close. Our county's COVID-19 test positivity rate is also already in the next less restrictive orange tier range at 3.2%. As a result of our new red tier status, all K-12 schools in Santa Barbara County may reopen to in-classroom instruction as soon as October 13th if we continue to receive red tier report cards for the next 2 weeks. The decision when and how to reopen schools remains with our locally elected school board leaders who are working with parents, teachers, students, and staff to determine the best course of action for their individual districts and schools. Each situation is different and presents unique logistical challenges. The good news is the path is now open. Dr. Susan Salcido, our County Superintendent of Schools, is here today and will be providing more information about our local schools later in the press conference. In addition to schools, houses of worship may now open services indoors with capacity limited to 25% or 100 people, whichever is less. I've heard a number of faith leaders will open their places of worship indoors this Sunday for the first time in months. What a welcome addition that will be. Metropolitan Theaters in Santa Barbara and Goleta will be showing movies indoors tonight for the first time in a very long time. Seating is restricted to 25% capacity or 100 moviegoers, whichever is less. Masks will be required indoors when not eating, and seating is reserved to ensure that there is adequate physical distance between moviegoers. Metropolitan Theater staff are also taking extra safety precautions to thoroughly clean theaters between movie showings to ensure patron safety. Similarly, many restaurants across the county are opening their doors to indoor dining this weekend, with capacity also limited to 25% or 100 diners, whichever is less. And gyms and fitness centers are also now able to open indoors at 10% capacity for the first time in many months. These new business opportunities are coming just in time as the season changes, the days are getting shorter, and nights begin to get cooler. We are again at a pivotal moment. Our local businesses need our community support. Please consider visiting local businesses this weekend. They'll be happy to see you. They've been preparing for months to safely welcome you back inside their businesses. Let's all be safe and smart and step up and spend our local dollars with local businesses. These entrepreneurs have been very careful about adhering to COVID-19 protocols as more customers come indoors. Please help them succeed by cooperating with all safety measures. This past Tuesday, the Board of Supervisors approved a commercial tenant protection ordinance so local businesses that are struggling financially because of the COVID-19 pandemic will not face eviction through the end of January next year. Supervisor Lavanino and I brought this measure to the board because we want to make sure that local businesses that are fighting to survive have the chance to reopen and get back their customers at this crucial moment in our fragile economic recovery. The progress we've made together to reduce the spread of the virus is a positive step forward. I want to take this opportunity to again sincerely thank all the residents of Santa Barbara County who've done their part to meet this challenge. By diligently limiting contacts, practicing physical distancing, wearing masks, and washing hands, the virus around us is declining. It's working because we're all doing the right things. Our progress is unfortunately tenuous and fragile. The potential exists for cases to quickly spread if we let our guard down. Canada, France, England, and Spain are currently experiencing a very troubling second wave of COVID-19 infections that are quickly growing past some of the peaks of the spring wave. We must remain vigilant and committed to protecting each other. We want to go forward to the orange tier by Halloween, not backward to the purple tier. We can succeed if we stay the course. Please don't get complacent. How many times have you washed your hands today? Today is National Disease Intervention Specialist Recognition Day. I want to extend my deepest gratitude for the tireless commitment of the dedicated public health department staff who've been on the front lines of the COVID-19 pandemic from the very beginning. We all continue to rely upon their skills and expertise as we move further into the epidemic and prepare for future outbreaks. In addition to responding to COVID-19, our county's public health staff have maintained other high-priority investigative work focused on preventing illness and death associated with HIV and tuberculosis. I know how crucial their work is to helping close the health equity gap because they are out in the community working to connect our most vulnerable residents with the information, treatment, and care they deserve. Today, we honor their commitment, expertise, and passion for protecting the health of the residents of the County of Santa Barbara. Thank you. Finally, we're less than a month away from Halloween, and like many other things, Halloween must look different this year. The County of Santa Barbara wants to help our kids show off their costumes and their creativity safely. Today, we're announcing a countywide virtual costume parade that will be televised on Halloween. Send us a photo of friends and family ages 0 to 17, pets count 2, dressed in costume. Selected photos will be shown on a televised and live-streamed virtual costume parade on Saturday, October 31st. Between October 9th and the 28th, send us your best high-resolution photo of kids and/or pets in their Halloween costumes to news@countyofsb.org. This information and more details will also be posted on the county website at countyofsb.org. We will show a video about the costume parade at the end of the press conference. Next, we have Dr. Vondo Reynoso, the Director of the county's Department of Public Health.
Thank you, Supervisor Hart. Santa Barbara County was assigned to the red tier on Tuesday with a 4.5 adjusted case rate per day per 100,000 and a 3.2 testing positivity during the week of September 13th through September 19th. So this is our first week in the red tier. We need to be in the red tier for at least 2 additional weeks, and during these last 2 weeks, we must meet the criteria for the orange tier before we can be assigned to the next less restrictive tier. To be assigned to the less restrictive orange tier, we must meet not only the case rate, the testing positivity rate, but also the newly established health equity metric. I'll be diving deeper into what this health equity metric means for our county during the next Board of Supervisors meeting on Tuesday. We have arrived here in the red tier by working together towards a common goal. To remain in the red tier, it is absolutely critical for everyone to continue wearing masks, maintaining physical distance, and limiting gatherings with others not in your household. We have to continue doing this to further decrease the transmission of disease in our community so that we can progress to the less restrictive tiers. I'm hopeful that we as a community can achieve these goals. With fall and winter holidays around the corner, we are concerned that new cases will be rising due to gatherings and celebrations. Thus, today, we are releasing our guidance for Halloween that our community can celebrate in a safe manner. A safe Halloween during COVID-19 pandemic is going to look and feel a little different this year, whether it's having fun from a distance, alternatives to trick-or-treating, enjoying Halloween at home, or something in between. You will be able to find the Halloween guidance on our website at publichealthsbc.org shortly after this press conference. There you will find ideas on how you can reduce the risk of spreading COVID-19 during Halloween. Because we are in a pandemic where the spread of COVID-19 is substantial in our community, traditional trick-or-treating will not be an option for kids this year. However, our guidance provides a modified trick-or-treating plan so that we all can have fun in a safe manner. We're asking our community to wear a face covering correctly during their Halloween festivities, even while outdoors. We encourage parents to allow their child to select their own safe face covering. Decorate a face covering together to match your child's costume. And don't wear a costume that prohibits you from wearing a face covering. All of the guidelines for day-to-day prevention of the spread of COVID-19 are still in effect. In addition to wearing a face covering, we urge parents to establish ground rules for social distancing and mask wearing with children before trick-or-treating. Trick-or-treaters must maintain 6 feet social distance from others and from different households. Practice good hygiene. If you are sick and have been in contact with someone who is sick with COVID-19 or has symptoms of COVID-19, please stay home and away from others. If you choose to pass out candy, consider a plan for social distancing and not directly touching the candy. I also want to remind everyone that gatherings with individuals outside your household are currently not allowed in our county. Again, the county has been assigned to the red tier where the virus transmission is substantial. Gatherings are defined as meetings or other events that bring together persons from multiple households at the same time for a shared or group experience in a single room, space, or place such as an auditorium, stadium, arena, large conference room, meeting halls, or other indoor or outdoor space. The more people an individual interacts with at a gathering and the longer that interaction lasts, the higher the potential risk of becoming infected with COVID-19 and COVID-19 spreading. We highly encourage everyone to celebrate creatively this year without gatherings and have included ideas in our guidance. We also, in our guidance, offer outdoor alternatives to trick-or-treating. In conclusion, I want to thank everyone for doing your part to decrease the spread of COVID-19 in our community. Please take care of yourself and protect others around you by being diligent to wear your mask, maintaining social distance, and by not gathering with those outside your household.
Thank you, Dr. Doroso. Dr. Henning Anser, the county's public health officer, is also here with us today.
Thank you, Supervisor Hart. Good afternoon, everyone. We are all glad that our efforts in the community with social distancing, wearing face coverings, and avoidance of gatherings is paying off. Our transmission rates have remained on a steady decline, and we are seeing a lower percentage of positive tests throughout the county. Even though this development is a good first step in the right direction, I want to caution everyone that while we are in the red tier, we are still experiencing substantial community transmission. At this stage in the pandemic, anyone can still get easily infected anywhere in our communities unless we stay vigilant with our efforts to defend ourselves against this virus. So please, continue with distancing, no gatherings, practice good hand hygiene, and wear your mask. These simple measures are our only defense, but also under our own control. We issued a new health officer order that outlines specific activities and venues that are now permitted. Some examples include movie theaters, indoor dining, indoor bars and wineries, all with a 25% maximum occupancy. Personal services like tattoo parlors, massage therapy, estheticians with specific safety guidance. Fitness centers, gyms, yoga or dance studios with 10% occupancy. Indoor museums with 25% occupancy. We're happy to report that outdoor playgrounds with specific safety rules are now open. A complete list can be found in Attachment A of the latest health officer order, which is posted on our website at publichealthsbc.org. For people who are now able to go back to work, it will be particularly important to do so safely. Every employer and business has a detailed mitigation plan in place, and we urge everyone to comply with it. Flu season is approaching rapidly. We strongly recommend to get your flu shot as soon as possible. Vaccination clinics are available at various locations and are free of charge. The locations and opening hours of the vaccination clinics from our county are posted on our website at publichealthsbc.org. We anticipate that all schools will get the green light to open, possibly as soon as October 13th. We continue to work closely with our school districts on how to open schools in the safest manner possible. Thank you, everyone, for your ongoing support in fighting this pandemic.
Thank you, Dr. Azorg. Dr. Susan Salcido, our Santa Barbara County Superintendent of Schools, is also here with us again today to share the latest news on local public school reopenings. Welcome, Dr. Salcido.
Thank you, Supervisor Hart. Thank you for the invitation for me to speak today. Moving from the purple widespread tier to the red substantial tier speaks to our community's efforts to lower the spread of COVID-19. I think this shift speaks to both the optimism we all feel from this positive change and to the caution that we need to have so that we don't regress, but continue to progress as we diligently continue our practices for a healthy and safe community. Should we remain in this tier for a total of 14 days, on October 13th, local school districts will each have the opportunity to decide when they will reopen. We in all schools look forward to being together in person, for meeting critical needs for students and their families, supporting the mental health of students and staff, and providing rich teaching, learning, and socialization for our youth. Currently, having just been in the purple tier, and while we continue in the red tier, we already have schools that have opened with specific permissions and by meeting health and safety criteria required by our partners at the Santa Barbara County Public Health and California Department of Public Health. Although updated just a little while ago, earlier this morning, there were 21 schools already approved to be open under the public health elementary waiver process here in Santa Barbara County. 2 of those schools are public schools, Cold Spring and Montecito. And there are additional 9 waivers under consideration. 6 of those 9 are public schools, including Blockman in the north and Carpinteria Elementary Schools in the south. Also, presently, schools have the permission to open up small cohorts from TK to 12th grade. These are cohorts of no larger than 14 students, and we're seeing students back at schools right now for small cohorts of sports teams for conditioning and small cohorts for language-specific supports, special education supports, and for those students with other needs, like those who need internet access. Santa Barbara County Education Office programs, the juvenile court and community schools have also been approved to support its small groups of students and are open. Finally, one-on-one supports are already occurring for those who require special education assessments or one-on-one physical supports at sites that are not yet open. The question on people's minds right now is, will schools open on October 13th? And the answer will be different across the county and by district. For example, some districts have already decided to remain in distance learning through this semester. Others are already open through a waiver, and still other districts are considering opening when the county moves from the substantial red tier into the moderate orange tier. Many districts are currently in the process of making decisions, so we will continue to learn about local decisions in the coming weeks. In the meantime, schools are working to meet all the guidelines required to open. Many are scheduling tests right now for employees at the county and state sites. Others are contracting with labs and scheduling surveillance testing for their employees. Others have ordered outside tents and extra hand washing stations, and many are working through transportation schedules because of the limited number of students allowed to be on buses. Others are looking closely at the local COVID-19 data. All are working within their local context to prepare for school reopening as their districts make decisions regarding when to reopen. I want to remind the community that when schools open, whether in red or orange tiers or even yellow, they may only open to the extent that the physical distancing requirements allow, meaning for many, because of the size of the student body and the facilities and available open space, school reopening may mean they can only open in a hybrid fashion to allow for more space for student groups. As I wrap up my comments, I'd like to thank colleagues and community members for continuing to reach out. I continue to meet with colleagues and hear from parents and community members with children in schools about ways they are trying to and are doing and keeping positive, but they're also conveying the very real, close to home challenges they're experiencing right now. I'm hearing from teachers, from first-time teachers to 31-year veteran teachers who are inspired by their students' perseverance, who are motivated by their teaching partners, and who want in every way to do right by their students and families, and who have taken every change, shift, and turn, and have remained true to their promise of making this fall very different than what it was like this spring. As a mother of 2 children in our public schools, and as a wife of a teacher in a local public school, and as a county superintendent of schools, I want to sincerely thank every employee in our school system, from teachers to food service workers to custodians and instructional aides. Thank you. I want to thank our public health department for your efforts in supporting our schools. We appreciate the work you do around the clock to support our schools. And thank you to our many partners in our schools. You are tremendous, and we're so grateful for your support. And thank you, moms and dads, and guardians and family members, for doing all you do to support your families and the children across Santa Barbara County. Please continue to practice the most effective health and safety measures we have as our tools: wearing face coverings consistently and correctly, maintaining physical distancing as much as possible, washing hands or using hand sanitizer frequently. Getting back to school in person and then remaining open depends on all of us. Again, Supervisor Hart, thank you so much for the invitation to update the community today.
And thank you, Dr. Salcido, for your leadership during this very difficult year. It's really good news to hear about the potential school reopenings in the very near future. We'll now go to questions from the room. Mr. Devine?
Just following up with Dr. Salcido, so how many school districts do you expect to reopen immediately, if able, on October 13th? If you just had to size up like the majority or half, or?
That's a really great question. So we have 20 school districts in Santa Barbara County. I'm just going to look at my notes because I was talking about those who've already applied for an elementary waiver. 2 plus the 6, that would be, 2 plus the 9, 6. Okay, so 8 are elementary schools. So of the 20, that would be 8 that would already be opening with the waiver process. And then there are quite a few other smaller school districts and elementary-only school districts that would likely open up sooner. And the reason is because the size of the student body, the size of the facility, the extent to which you can physical distance really does come into play. Having said that, I will say that all of the school districts that I've been speaking with every week are in the midst of making decisions. So truly we'll begin to hear more in the next week or two about opening decisions. Having said that, let me couple that with the fact that there have already been some districts that have decided to remain in distance learning for the rest of the semester. So then there will be about 8 or 9 that we'll hear more about in the next coming weeks.
For those large districts, what do you think is the biggest difficulty with the transition from moving remote into in-person, possibly hybrid?
As I was saying, I think that the student body, the fact that you need to be able to distance within a classroom and to make sure that there's space for the teachers, the students, but also the staff. They're also currently working on surveillance testing for all of their teachers, and you have a lot of staff and employees. We need to be testing them every 2 months, so we'll have a quarter and test them 1 week, and then the next quarter, the next week. So these plans are all working. They're in motion right now, but they really need to be implemented so that schools can reopen.
Thank you. A question about Halloween. I guess my question is, you were talking about modified trick-or-treating. Can you just explain a little bit about how that looks? Because I know you're also emphasizing gatherings being avoided at all costs, but what does modified trick-or-treating really look like in a neighborhood setting?
So that would look, and the details for the guidance is available after the press conference. So what that would look like would be for families to wash hands before and after handling candy, considering not passing candy from inside the home, but rather have grab-and-go candy from the porch or driveway instead of the front door, using tongs or grabbers along with hand sanitizer. And then families could certainly bring their own tongs or grabbers to grab candy as well. The use of face covering for everyone on both sides, using a 6-foot table lengthwise in front of the door so that you can really ensure the physical distancing, making a variety of treat bags with commercially packaged candy and hang them from streamers in the yard and monitor for social distancing. So these are some of the ideas that we have in the guidance.
And just to clarify, trick-or-treating will be allowed with those rules in place?
Correct.
Will certain residents only be able to trick-or-treat in their neighborhood, or can they go anywhere in Santa Barbara?
So these are really broad guidelines that we want to encourage families to restrict their movement to other neighborhoods where they may be unfamiliar with the neighborhood or the crowds that may be there. So what we want to really emphasize is you could do this, but do it moderately, and definitely make sure that you do it safely by restricting your movement, avoiding crowds where you have no control over the physical distancing.
Thank you.
Thank you, Mr. Devine. We'll now go to questions on the phone.
Yes, first up, we're going to Laura Place with Santa Maria Times. Go ahead, Laura.
Thank you. I was wondering, Dr. Vondo Reynoso or Dr. Ansorg, if you could give the case update for today.
Yes. Let me grab my notes. We have, as of today, 26 new cases. Total confirmed cases stands at 9,249. We have 168 still infectious. We have 115 total number of deaths, with no new deaths being reported today. We have 18 hospitalized, with 5 in the ICU.
Okay. It looks like there's a death listed on the status report page for today, even though it says there's no deaths. I don't know if that's just something to do with logging the data, but okay, so there were 26 yesterday and there's 28 and 26 today, it sounds like?
Correct.
Okay, thank you. And then my second question is regarding testing platforms. I know Dr. Comer a few weeks ago had mentioned the possibility of the county obtaining another testing platform from Abbott that would allow for more testing and faster testing. Are you able to give an update on that?
Do you want to?
I don't recall exactly what Dr. Comer talked about. There is a new Abbott quick test, which is an antigen-based test that is has become available, and the county will actually receive an allocation per the state in the very near future, and we will utilize this for frequent testing. That is the Abbott, I think, ID Bax or something like that. And it's a very simple test. It has to be utilized with just nasal swabs, so not with a very long stick up to the nose, but only in the what we call mid-turbinate in the front of the nose, so it's less inconvenient and will be readily available.
Okay, thanks very much.
Thank you, Ms. Blaze.
Next up, we're going to Tom Bolton with NewsHawk.
Thank you very much. I don't know if this question is for Susan or one of the public health folks, but I'm wondering what kind of guidance and rules are going to be in place once schools do reopen in terms of what happens if either a student or a staff member tests positive for COVID-19.
I'm happy to start, and then maybe we can collaborate on the response. But we have been working, thank you for the question, and we have been wanting to be proactive in understanding how to handle cases, whether it is a student or staff member who may have been exposed, someone who actually tests positive, somebody who's ill, because there are health screenings required each day. So we have worked with public health, who has created matrix, templates, letters for us to be prepared should that occur in our schools. At this point, if I could toss it on to Dr. Ansorg to explain what that would be. Thank you.
Happy to. Yes, we have worked collaboratively with all the schools and school districts for weeks now, and under guidance from CDPH, there's a very good process in place. Every school has actually a health liaison to public health. This person in most schools will be a school nurse, but in smaller schools can also be somebody else, and they will have all the information readily available for our public health disease control team, and so we will be able to make case-by-case decisions in collaboration with the individual schools, because every situation, every outbreak or exposure has a different makeup and needs a different intervention. But we are posed, and we have enough staff added on to work closely with these school liaisons if there were positive tests in schools.
So in the case of positive tests and or exposure, they would contact public health, and then you would make a determination based on the circumstances as to whether other people needed to be quarantined or that sort of decision?
Exactly. Very similar to any other outbreak, for instance, in a nursing home or in a congregate setting like a homeless shelter or anywhere where many people live or spend a lot of time in close proximity. We have these measures in place, and now it's extended to schools as well.
If I can add to that, training has already been taking place around the school districts, the county education office, schools, districts, nurses with public health. School teams have been training staff just for this exact purpose, to make sure that we're ready before something were to happen, rather than have to scramble if something happens that day.
All right, thank you very much.
Thank you, Ms. Bolton.
Tom. Next up, we're going to Reza Georgie with San Ynez Valley Star.
Happy Friday, everybody. This question is for Dr. Salcido. Have you been talking with any other county school superintendents like yourself who've reopened already, maybe in the state of California or other states, about what they're seeing, what works, what versus what doesn't? I know opening might be a little bit easier as far as elementary wise, because the kids stay with their class during the day as opposed to high schoolers, which move around and have different grade levels in the same class.
Thank you, and happy Friday to you too. And I've spoken, we meet weekly with the other county superintendents from the state. And of course, the primary topic is reopening right now. And I spoke with a county superintendent yesterday, and in their county, they're also now in the red. Schools are able to open and only a few districts have opened up so far. And as you said, most of them are elementary schools. I also have colleagues in counties who were never on the state's monitoring list, for example. They may be actually approaching orange. They just have had less of a widespread COVID-19 case rate in their county, but even there, the districts have decided to only now begin to reopen. So we're seeing more examples. I have a K-12 example, I have a high school example, but they're very, very few right now. They're just beginning. I understand in another county where they were also received announcement that their county entered into the red tier on Tuesday, like our county. For their county, only elementary schools will be able to open even after October 13th. So it's different across the state. So I think I responded to those questions, but if I didn't, let me know if I can respond further.
Yes, thank you. That was my only question.
Thank you.
Thank you,
Thank
Ms.
you,
Georgie.
Reza. That concludes our Q&A.
Thank you for those questions. The Board of Supervisors will hear a COVID-19 update from Dr. Do Reynoso and the Public Health Department on Tuesday, October 6th at 9 a.m. The county's newest weekly state report card status will be announced at that time. Our next press conference will be held a week from today on Friday, October 9th at 4:30 p.m. If you have any questions, please call the 211 information line. Local information on COVID-19 and access to support and services is available 24 hours a day, 7 days a week in multiple languages. Please continue to practice these 3 simple personal steps every day. Number 1, remember to wear a face covering and stay at least 6 feet away from other people. Number 2, wash your hands thoroughly and often. Don't touch your face and disinfect surfaces. And number 3, if you feel sick, stay home. Don't go to work. Isolate yourself. Call your doctor or clinic and follow their medical advice. We'll now roll a quick video with more information about the county's virtual Halloween costume parade. Thank you for joining us today. Please be kind, considerate, and patient in your interaction with others. We are stronger together, safely apart.